When Pope Francis visited the U.S., one of the first things people noticed was his limp. He was not injured. The pontiff suffers from a fairly common chronic condition known as sciatica.
Sciatica is a term used to describe a group of symptoms, mainly back pain that radiates down the leg and sometimes into the foot. The pain can be sharp, lancinating, or even electric. Sometimes you can have associated weakness with it. It typically involves one side, but also can involve both sides.
That pain can be occasional and mild, or constant and debilitating. A 2010 car accident left Phyllis Smith with a lower backache that eventually became excruciating sciatic pain.
You get to limping to where you can't even walk sometimes. And there's been days where I've been to the store and couldn't get back. So, yeah, I have to sit there and just wait for a while until it just eases up. I've sat for probably almost 30 minutes before I drop.
So what's happening that causes this pain?
Between the bones, they are cushion, or shock absorbers, if you might call them, or discs. So these discs, they provide cushion to prevent the bones from rubbing against bone. In some cases with sciatica, these discs can slip out of place, or the term we use is called herniate. If they're herniate, as in this case here, you can see it can pinch on the nerve as it exits out. When it pinches on the nerve is irritated, causing pain to go down the distribution of the leg, as well as causing weakness. Just relax.
There are a number of risk factors for developing sciatic pain. As in Phyllis's case, an accident or injury to the spine or a disc can cause inflammation, putting pressure on the nerves. Obesity or a sedentary lifestyle can put extended weight on the spine and discs, which can also press on the nerves. Diabetes can put you at risk for nerve damage, causing nerve pain to radiate down your back and legs. And age. Over time, the discs lose elasticity and fluid, and they become brittle and can crack. Treatment starts with rest, but not too much.
So I'm going to lift up this leg and tell me where you feel it. Do you feel any pain? A day is okay, but you don't want to remain immobilized, because the more you remain immobilized, then the symptoms can get worse.
Doctors also suggest stretching to release the tension in tight muscles. Over-the-counter anti-inflammatory pain relievers also may help. Ice can reduce inflammation and relieve pressure on the nerves, followed with heat to relax the muscles.
The muscles, once they're irritated, they have a propensity of becoming very tight. Also, again, lumbar support and watching how you lift things as well. So there's certain things that you can do periodically, and also even periodic massages as well too can help relieve some of that tension in the muscle as well.
The good news, say doctors, is that most of the sciatic problems will go away over time with care and attention. Holly Purfer, CNN, Atlanta.